Troy Carter hosted a panel of high-ranking Democrats to answer questions about cuts to Medicaid. Jacob Bradford explains.
Well, Lauren, that was everyone's main focus tonight. What will happen to Medicare and Medicaid now that the president's big, beautiful bill is now law? Congressman Carter says we could start feeling effects from the bill by the end of this year. Carter says because of the cuts, 33 rural hospitals in Louisiana are at risk of closing. Republicans, though, say the new law sends in $50 billion for funding increases for those hospitals. But Carter says rural hospitals will no longer be able to afford to offer certain programs or initiatives. That means people with private insurance will have to drive to hospitals that can help them with their needs. Carter also says more than 600,000 people in Louisiana are now at risk of losing their health care. That is also something that Republicans deny. Congressman Carter says he worked with then Governor John Bel Edwards to expand Medicaid in 2016. He now says all of that work will be undone.
With that expansion, some 638,000 people were added to the rolls. 638,000 people. Nearly 1 million people added to the rolls. Rural hospitals started reopening, providing resources. My friends, the reverse is also true. Many of those people will come off the rolls. Many of those hospitals will close. And yes, as painful as it is, people will die.
Last month, we spoke to Republican Senator Bill Cassidy. He said people who truly deserve Medicaid will not lose coverage, but able-bodied adults will face new requirements to receive those benefits.
If you are disabled, if you have dependents, or if you are in school, volunteer work, engaged in society, are working at least 20 hours a week, you can stay on Medicaid. Now, there's a group of people, though, that don't meet any of those definitions, and they will lose their benefits under this law.
Congressman Carter says that when people lose their benefits, they will use hospital emergency rooms, which creates bigger, more expensive problems like ER backlogs and taking more money away from rural hospitals. Democrats at tonight's panel said the work and volunteer requirements to get Medicaid benefits ignore invisible issues such as mental illness. They also said that people will see their health insurance premiums increase by the end of this year.